Donna Stalter here at Fairfield Medical Center. I'm the public relations specialist here at the center, and I have with me today Doug Mallory, who's one of our cardiac rehabilitation patients, and he's going to give us a little insight on cardiac rehab and what it's all about. So can we first start with how you benefited from cardiac rehab, what you think is important about cardiac rehab?
It's to get into your health, to get yourself back in shape the right way.
Yes.
And I'm glad I did it. I really am.
Yeah, that's good. That's good. What did you think about having the opportunity to go to FMC instead of going up to Columbus?
Well, I liked it for the convenience. It was close to home. Economically, it's great. It saves a lot of running back and forth to Columbus, and it was a good move.
Yeah, because it's only how long of a drive for you?
I'm 4 miles outside of town, so it's maybe 15 minutes.
Just right around the corner.
Yep,
that's great.
Sure is.
That's great. That's good. And what do you think about the staff that helps take care of you while you're in here with doing your exercising and everything?
They've got a real good staff.
Yeah.
Great. I mean, they take their time. If you need the help, I mean, it's just like if you need it, it's just like one-on-one. And they do what they got to do with you in here.
That's good. Is there anybody that stands out the most for you?
Yeah,
maybe above and beyond?
I've had a lot of help with Misty.
Yeah.
She's real good, and like I said, she'll help you. If you got questions, she'll answer them. If not, she'll get the answer.
When you were first told to have cardiac rehab, what did you think? What was going through your mind?
I wasn't sure what it was, but
you had your doubts. Yeah.
Yes, I did. But I come in and I've talked to Lacey. She explained the program, what all they do, what it's for, how it works. And after that, I just said, let's do it. And it's been great since then.
You're glad you made that decision?
I'm glad I did make that decision.
Sure. Because it's nice that, the staff that takes care of you are professionals in that field where, they have you hooked up to the EKG machine there. That way your heart can be monitored during the whole exercise, program. So that's helpful. And the classes that they provide, what did you think about the classes?
The classes are great. I think there's 7 different classes, 1 a week.
Okay.
And they're very informative. They give you the information, you take it home with you, read over it, go over it. You got any questions, like I said, you just ask them.
And they
take
have
care
the
of
answer.
it. Yeah.
Yeah, that's good. That's good. And what did you think about the doctor that took care of you? They come in, they ask you questions, and then you also have exercise physiologists coming in and talking with you and giving you tips, to even take home, right? Because once you get home, you want to be able to exercise, like to kind of keep up that healthy program.
Yeah, they set you up for when you're outside of here, what you can do, what you should do, what not to do. The doctor, all the help, I mean, they're right there.
Yeah.
I mean, they're willing to, you got any questions, you got any problems, they're right there. They help you.
That's good. What about food? Do they give you, healthy choices when it comes to food? Give you any tips for that?
Yes, they do.
Good.
They actually, in some of the classes, they give you lists.
Oh, wow.
And on your dietary, it's a great thing. I mean, a lot of things I didn't know.
Yeah.
So it helped me out.
The insight on what foods are healthier than others and what to watch out for and everything. Because I'm trying to, I know, there's a huge focus on wellness, and, when you have heart issues, that's even more of an incentive for you to, eat healthier and know what's good for you and what's not good for you. Yeah. How have you progressed since you first started in the cardiac rehab program? Like when you first started, did you find yourself not, going as much on the treadmill as now?
When you first start out, you can't do as much. I mean, you want to, but your body says no.
Yeah.
And then as you put the sessions in, you can endure more time on the exercises, and I've progressed pretty good. I mean, they've been right there with me.
That's awesome. So, you can fall back on them if you find yourself getting a little exhausted, they'll give you tips on, now go at your own pace. That's nice to have that push, and also to have other people beside you doing the same thing that are in the same program. That's nice to have, moral support when it comes to a program like this. What do you find most rewarding about cardiac rehab? What was the thing that stands out the most that you found? Are you able to not be as short of breath as you used to be when you do certain things at home, or have you noticed an impact in those kinds of areas?
The cardiac, they show you how to do things properly, not overdo it, but do it enough to where you're getting the proper exercise, the physical work, and it's a good setup here.
You gradually get back into the swing of things instead of rushing yourself
right
after surgery.
You don't want to go too quick.
Yeah, because then you'll just fall behind instead of going forward.
Yes.
Exactly. I know some health insurance companies don't cover the cardiac rehab program. Some usually have lots of high copays. What has been your experience with this, and how has FMC helped you with this challenge?
My experience was 3 weeks after I was in rehab, we switched to insurance companies.
Okay.
So I went from 100% pay to having to pay it all, and I couldn't do it.
Yeah.
So I went to
those copays add up after a while. Huh?
Yes, they do.
Yeah.
So I went to the cardiac people, and they talked to some of the folks around here, and they helped me out. They got me set up where I could financially stay in, because if not, I wouldn't be able to stay in the rehab.
Yeah, because after a while, like I said, all that money, it could really cause a bind on you, and you just can't do it.
Well, if it wasn't for their help, I probably wouldn't finish my rehab.
We have a run coming up soon, and what we call that is the heart run and walk. It's not just a run, which is nice. And are you looking into maybe coming to that run?
I've got it on the schedule. I'd like to participate in it.
That's great. That's great.
So if everything works out, I'll be there.
That's some of the funding comes from that run, and I've been there, and it's great. I mean, the turnout we get, and we get kids coming, not just adults, and it's great to see them out there, and
I talked to your staff, and I know there's some of the staff that works in here that participate in that. They do a lot of running to raise funds.
And it helps out, it promotes health and wellness for people in our community. So we're really excited about that event. And let's talk about how you have been since having cardiac rehab. Do you notice yourself being able to be in your normal routine to get back into the swing of things?
Yeah, I'm starting to get back into my normal routine.
Good.
Like I said, I get up there and your body tells you whether you're trying to push it too fast, too quick.
Yeah. You notice it.
But no, I've gotten back into my routine. Plus, I'm going to the rehab, so it's working out.
That's good. That's good. Do you have anything else that you would like to add about receiving cardiac rehab here at Fairfield Medical Center?
I mean, I just think it's a great facility, great help, and to me, just where I live, the location, it just all worked out, and it's a great place to go.
Yeah, because most hospitals our size don't offer a big gym like this, so it's great that we're able to offer that to our patients. Yes.
I don't think a lot of people know it's even here.
Yeah, and that's what we're trying to do, is promote more awareness, because I mean, it really impacts a lot of people's lives, and I'm so glad to see you, here today, saying how much you've benefited from the program. It's nice to get that word out. So.
Glad to be here.
Yes. Well, thank you so much for being interviewed today here at Fairfield Medical Center Cardiac Rehab, and good luck with everything that you do. You're welcome. And this is Donna Stalter here at Fairfield Medical Center's Cardiac Rehab area. People you know, care you trust.